Hello everyone. Today we are gonna explain to you about the kidney stones, which are also known as nephrolithiasis. Kidney stones are the stones formed in your kidney. This condition is one of the common conditions which is associated with abdominal pain. You may think, what's the big deal in this? You have some disease, take some medicine, you'll get treated and you will be all fine. So what's different? Remember, it's not a joke. And people who never had this before won't understand that this is so terrible and irritating for your day-to-day life. It can happen to teenagers, adults or old age people. It can happen to anyone. Once you have kidney stones, if not eradicated or removed completely, it may be a concern of on and off disease. You may end up in an emergency with so much pain and discomfort. It varies in number, size and different types. It really does come in waves. It can be terrible, excruating. Sometimes it can be asymptomatic and undiagnosed. Then when the symptoms appear, it may become worse. These stones can cause damage to your renal and urinary system. So what are these stones that are made of? Why the stone formed? What are symptoms associated with these stones? Let's know the details. Before starting, we'll have another video on the management and treatment of kidney stones. Stay tuned for that. And let's know the reason behind these stones formation. Kidney stones. What are they? This involves formation of stones within the kidneys. These are the deposits of minerals and acid salts that are stuck together in concentrated urine. They are very painful, also called as renal calculi or nephrolithiasis. It can be one in number or multiple. Different sizes and different types of its formation. It can be present anywhere in the kidney. So what happens is, when it starts to pass through the renal system, the symptoms start appearing. These stones can cause a variety of symptoms and signs. That means when the stones are in the kidney, it is mostly asymptomatic. It passes from kidney to ureter, then to bladder, and finally through urethra it comes out from our body by these renal and urinary systems. So in this part, the symptoms are usually associated, varying from site to site. So what are the causes of the formation of these kidney stones? Why and how these stones formed? The biggest risk factor for kidney stones is not drinking enough fluids. Another main cause of formation of kidney stones is the dietary factor. You eat foods like fish, shellfish, poultry, pork, and meat. And this makes the urine more acidic and hence results into uric acid stones. Other factors are calcium-rich diet, which precipitates calcium to form stones. Infection. Recurrent urinary tract infection, UTI, is another factor responsible for the stone formation. Microorganisms like Proteus, Klebsiella can cause stasis of the urine, inadequate urinary drainage by producing urea, and can form stone. That means more the concentrated urine, more the chances of the formation of stones. As urine passes through the kidneys, it can become very concentrated. When the urine becomes too concentrated, calcium, uric acid salts, and other chemicals dissolved in the urine can crystallize, forming a kidney stone or renal calculus. So these are some causes that can lead to formation of stones in your kidney. Now let's know about the types of renal stones. What are these stones made up of? These can be of calcium oxalate stones, which is the most common type of stone found in the kidney, mainly formed in acidic urine. Then we have triple phosphate stones. These can form staghorn calculus. Uric acid stones can form when there is too much acid in the urine, which can result from eating too much fish, shellfish, poultry, pork, and meat. And last is the cystic stone, seen in young girls at puberty. In females also, UTI, urinary tract infection, is more common, which can lead to kidney stones. So these are some of the types of kidney stones that are seen commonly, and the stones are made up of these only. Now let's talk about the main part. The signs and symptoms you might see in a patient having kidney stones. Most of the time it can be asymptomatic. Because remember, when the stones are in the kidney, the symptoms may not appear, but when they tend to pass from kidney through the renal and urinary system, the movements cause the symptoms. That means when the kidney stone moves around within the kidney or passes into one of the ureters. The ureters are the tubes that connect the kidneys and bladder. If a kidney stone becomes lodged in the ureters, it may block the flow of urine and cause the kidney to swell and the ureter to spasm, which can be very painful. At that point, you may experience these symptoms. And the main symptom is the pain. There will be pain in the abdomen. It will be severe, sharp pain in the side and back of the abdomen. That means it is localized to the flank region. And these pain can radiate to the lower abdomen, pelvis region and to your groin. The next common symptom is a painful urge to pass urine. That means when you go to pee, you will have a painful urination. It's mainly due to the acidic nature of the urine. And the movement of stones to pass through your urine makes it worse and you will have painful urination. Associated that you may feel nauseated, you may start vomiting. There will be increased frequency of micturition, persistent need to urinate, urinating more often than usual or urinating in small amounts. Complete voiding of urine would be not possible. There can be hematuria, fresh blood in your urine which can be in small amount. History of recurrent urinary infection, UTI. This can lead to fever, chills and rigor, urea. When the stones move to the ureter from the kidney, that means stones are in the ureter, it may cause severe colicky pain. The pain will radiate in nature and it is known as ureteric colic. And these are the symptoms that can be the complaint of the patient having kidney stones. So we have 3 stone categories for our renal system. If the stones are in the kidney, then it is said to be kidney stones or renal calculi or nephrolithiasis. When in ureter, it is ureter stones, and when in bladder, it is bladder stones. So these are all about today's video. How the stones formed, what are these stones made up of, and the most important part, that is the symptoms that a person having kidney stones will have. Stick to the details. If you feel any symptoms associated with pain in your flank region of the abdomen, that means you might have kidney stones for which you need to be treated and on time, else it may get worse. In our next video we will learn about the management of these stones. What are the treatment methods to remove these stones from your renal system? So that's all for today guys. Do like, share and subscribe to our channel Doc Medicine. And for your queries, just ask your question in the comment section. Thank you all for watching.